You're a doctor. We know you're an expert in medicine, and we know you work hard to be helpful. We know that you care.
We're teens, and we're experts in being teens, which is why we're talking to you, because we want you to understand that our health means everything to us, and that sometimes going to the doctor can be hard.
Even though we're all different, here are some guidelines you can follow that will help us feel more like listening to you and help us feel like we have a voice in our health.
We want to know our honesty will never be punished and no assumptions will be made. Be straightforward with us. Confidentiality is key.
Let us know how your policy works. Show us where it's posted. Clearly explain what you have to share with our parents or guardians and what we can ask you not to share.
We are each our own person, and we need to know we're getting the full version of what's going on with our health.
It might sound basic, but be human. Start from there to show us you care.
This might be a simple question about our day or a random story about your drive to work. Breaking the ice with us can be that easy.
You don't need to try to be our friend, and you don't need to try to use our slang or make pop culture references to relate.
Just calling us by our preferred name and remembering that what we're interested in can go a long way.
And if you ever run late for an appointment, try to acknowledge our frustration and meet it with your patience. And if we're ever late to our appointment, keep in mind we're not always in control of our circumstances. Your patience with us is really appreciated.
Talk to us like we're adults, but check in with us and make sure we understand the terminology, the causes, and the consequences. Please help us understand our options, but not too many. And if we don't seem in the mood to talk much, please don't push us.
It's not personal. We might be struggling with some sensitive subjects, and sometimes it's just tough being a teen.
So last time I was at the doctor's office, my mother was in the room every time I would answer a question. And I had no idea what I could or could not consent to, and it made me feel like I had no control over what was happening to me or my healthcare or my own body. It would have helped if the doctor had asked my mother to leave, if I had been able to talk to him one-on-one, and if he had some sort of poster or pamphlet or just told me verbally what I was allowed to say, knowing that it would not get back to my parents, and what he would have to tell her.
I've gone to the same doctor my entire life and personally know them, and there have been instances where when they're asking us like questions when we get our physicals, like, do you smoke, do you have sex, and because they personally know us, they just assume that we don't do any of that, and they just immediately are like, oh, you don't have sex or you don't smoke, and just makes us feel like less comfortable to tell them the truth.
When I was younger, I was suspended from school for kind of just like a tempered flare, you could say. My mom decided she was going to take me to my doctor, and she treated me as if I were a child who'd had no concept of right and wrong, and it just did not make me feel like I was understood, and I needed that understanding. I didn't need a lecture. We don't speak for all teens, but we do believe that you can follow these fundamentals to help treat us with better care.
To help us see how you care, no matter how different we are. Be straightforward.
Be human.
Confidentiality is key.
Check in with us.
Talk to us like adults.
Give us options.
Keep us in the loop.
It's our body, our life.